So we just talked about the food, and the ringbone is a lot of special conditions for the horse. There's some little bony swelling in the foot, and then the main idea is you can herbal-wise you can use topically like stasis breaker, try to broken down the the stagnation, like stasis breakers, and then try to identify, underline if the yin deficiency, orally use stasis break, bone stasis with heart of one, yang deficiency use the Shangzhishan combined with bone stasis. Poor hoof quality, that's also very, very common for these older animals, and then that could be a lot of deficiency associated, like many is liver yin, kidney yin deficiency, sometimes could be general qi and blood deficiency. So it depends on tongue color, depends on constitution. Usually for the yin deficiency, this is more like a fire constitution, wood constitution, because wood, fire tends to be hot, tongue is red, left side pulse weak, that must be liver yin deficiency. Qi and blood deficiency basically is more weakness. It's more like earth constitution. So if there's liver yin deficiency, Equine we mentioned about a little bit for that is basically for liver yin with kidney yin deficiency. Qi performance is I use a lot for racehorse, but also can be used for general qi blood deficiency with stagnation. And then Si Wu Tang, what's a Si Wu Tang? Blood tonic. Great. So fatal lock pain, diagnostic point is mainly is triple header 16, and sometimes could be large intestine 16 or 17. And then, so again, basically triple header 16, that's a major one. And then, easy to remember is the fatal lock is 16. So triple header 16, large intestine 16, small intestine 16. And then primary for this is local point, distal point, balance point. So if there is local problems, a lot of time we can use relief salves. Relief salves help the topically used to help the pain relief. Tender ligament, and also is very, very commonly say for the athletes because we're used need this soft tissues. Tender ligament is performed. And a lot of time could be initially acute onset and has injury and then gradually become chronic. So there could be, if the primary is acute, is more qi and blood stagnation, but underlying could be liver blood deficiency or liver yin deficiency. The major point is triple header 15. That's main point is triple header 15. And then if this is I need a lot of the points there. Mostly is for local balanced liver, balanced gallbladder, and herbal-wise, I tend to use topically for relief salves. But I find that tender ligament works beautifully because tender ligament can be for liver yin deficiency and liver blood deficiency. If animal has a pain or big issues, we can combine with body sore. Let's go into one case to say how we can manage the tender ligament. This is a 2 years old racehorse. They were going to Kentucky, April sales. Has acute onset of left front lameness 3 days ago after training. That day, that morning, the racetrack is very, very soft because raining one night before. So racetrack is so soft, so deep, and then 2 more horses have similar issues. So this like more because exercise and then try to work out and then cause the trauma. And then, so this is acute onset 3 days history. And then this is a rush for Kentucky April sales. Only 1 month left. So time is essence. If this horses cannot meet the time, that's 1 year is gone. And so we want to give intensively care or treatment to get quick results. That's what the way it works for the horse industry is the time is very important. You have too much time to work with. So sometimes acupuncture play very important roles because it can help the quick actions to diagnostically or treatment. So the first time we scan these horses, many we find is bladder 18, 19, 2 plus, but very, very strong reactions. They find this small intestine 16, triple 16. How does that indicate? That is the tender ligament is suspensory. Yes, suspensory triple 15, and the left side small intestine 16. But the right side also 4 plus is bladder 53, 54 lugu. That's referred to the hip. So basically, this horse has the angle has right rear and the left front. When you find it has a lot of sensitivity, try to figure out what's more sensitivity. Try to pick up 2 locations. So like 4 out of the 5 at the left front is suspensory. That must be the issues with the history of this left, clinically left front limb. And then right rear, that's 4 plus, that must be compensate, like contralateral or the combination to have the 2 issues. The tongue is purple, post-virus, that's underlying stagnations. So your final diagnosis has a local stagnation at the left suspensory and the right hip. So we use acupuncture is body sore and the tender ligament because for underlying how we can help the tender ligament getting more healthy, we need to supply the nutrition for the liver in and the blood, nourishment and tender ligament. Tender ligament getting healed by liver in, liver blood. So we need to tolify liver in, liver blood. That's tender ligament formula about. And the body sore basically for pain management. And then we want a quick reaction, so therefore we want to use topical relief salves. Also we use weekly acupuncture. And the first week I strongly recommended the horse owner to have the storage because a lot of horse people don't like that idea at all. Because you feel they're training so hard, getting this level, if you rest, they might be forgot about those high-speed type. But I said, if you're doing that, you might get more injury. So they says, okay, right at this point, let's try this. So at least store rest for 1 week. It's okay to do hand work like 20 minutes a day. Mild exercise help allergy movement. So second week we go there, then become 50% better. And then we do more store rest, but hand work is more like 30 minutes twice a day. And the third week is sound. So we're able to store rest, but also able to go out to juggling and ride, but only 10 minutes. And then go into more back to the normal, like a gallop and everything. So this horse sold about $500,000. So you do have those. So as you can say, for those race horse in the time-wise, you can go into more intensive acupuncture. It definitely is okay to do twice a week of acupuncture, but I feel confident is once a week is enough because we use a topical relief, herbs, also we use oily herbals. Back shims can be also the issues for the thoroughbred industry. Like some of the reports show, for the 2 years old thoroughbred, 70% of them have some issues about back shims. So for this, of course, is too young has problems. We must be has underlying kidney gene deficiency. Of course, has local stagnations, and then the many back shims occur in the triple header, small intestines. So when you treatment distal point, we need to work on triple header and the small intestines. Herbal-wise, basically we need to resolve the pain, like a body sores, but and then Jacosan play rules to tolify kidney, qi, and also help the bone to be healed. This is one of the classical equine herbal recipe. And then, like this case, has 2 years old thyroid